My name is Rachel Miller, and I'm a current student in the DNP program here at Belmont. As a kid, I've just always had a passion for helping others, a passion for medicine and science. Combining those two kind of drew me to nursing, but I don't think that was an obvious decision. Originally, I wanted to be a speech pathologist. Nursing actually was more like all-encompassing. I decided to come to Belmont, went to 4 years here. I started my nurse residency February of 2023. As a brand new nurse, you come in and you're like, I'm gonna change the world. When I hit a year, I just felt like, why am I even a nurse? What am I doing? Am I even making a difference?
I'm Robin Mutz. I've been a nurse for 46 years. I started out at the bedside caring for women and children and ended my career as the chief nurse at St. Jude Children's Research Hospital in Memphis. There's been a nursing shortage for a very long time, and it has been significantly compounded by the COVID pandemic. By the year 2030, we're going to be short 300,000 nurses in the United States. This is not as advertised. The work is hard. There aren't enough people to do the work. The pay is not supportive of the caliber of work that needs to be done.
Having 5 patients to 1 nurse can be really hard. My husband has to kind of read the room when I get home, like, what kind of night did she have? You can't bring your assignments and your like actual work home, but you do bring that emotional stress and burden and exhaustion home. Feeling like I did all that I could, but I feel like I made no difference.
Disillusionment really doesn't happen until you realize you don't have the safety net that you had in a learning environment. I'm really responsible for this person's care, and they could die in my hands. People get overwhelmed by the level of responsibility because we don't ease them into that. We just give them 5 patients and say, do the best you can.
I left after like right around 2 years from bedside completely. It was affecting my life, and it was affecting my relationship with my husband.
Do you remember your lowest point?
It was 11 months in. I remember just being like, I don't care what happens to patients. And that was kind of scary. I needed help.
We haven't changed the way that we educate nurses in over 70 years. The Center for Nursing Innovation is a place where industry, academia, and practice partnerships come together to work on sustainable solutions for the nursing shortage.
I am Kelly Brady-Smith. I'm the Director of Partnership and Innovation for Bedford Falls Foundation. Bedford Falls Foundation is the private foundation of Bill and Joanne Conway, predominantly supporting nursing education. If we train nurses who are quickly leaving the field, we're filling a leaky bucket. We are working with schools, ensuring that their student is going to make it to the finish line and then going to thrive in the workplace. Belmont is talking about changing the way we educate folks, but also equipping them to be leaders who can change the healthcare system.
I used to joke that as an undergrad student, I was going to become a professor so I could change nursing school. Now maybe that's actually what I will do.
I really think that the secret sauce is in the match. What does industry need, and what can academia provide?
What's happening right now isn't working. And when people are willing to acknowledge that, you know they're poised to problem solve. That's what's exciting, and that's what we want to invest in. We want to invest in people who are willing to try new things and truly innovative things.
Belmont Nursing is poised to change the trajectory of the profession for good, and we just need a little time and space to do it.